Okay, a lot of people want to look younger, right? But it's safe to say no one likes going under the knife. Dr. Sherry Ingraham with Advanced Dermatology has some less invasive options to help you look your best. Good morning to you.
Good morning. How are you?
Well, we're glad that you're here. We have Michelle, who has so graciously donated her face. Oh, no, I'm kidding. To be able to do a procedure live on air, and I'm proud of you for doing that. Are you a little nervous? How are you feeling?
I'm okay.
Okay.
Thank
All right,
you.
Michelle. Tell us what you're going to be performing today.
What we're going to do to Michelle today, if you look at Michelle, she has wonderful bone structure, and she's actually had some Voluma before, but we're going to do a touch-up. Voluma is the newest and only FDA hyaluronic acid filler that's approved for mid-face correction, essentially to lift the cheeks, which we know is so important in the aging face now, to give that what we call triangle of youth, where you have a point at the bottom and a triangle going upward. So we're trying to recreate that triangle. So this is her Voluma touch-up. This is Voluma, and it's a thicker filler than what we've used before, than your Restylane or your Juvederm.
And you're going to be working on the left cheek, so don't worry if anyone's scared of needles. We're not going to be showing anything close up. It's going to be all right. But will we be able to see a difference in this amount of time?
Absolutely. And that's the beauty of Voluma. You get immediate gratification.
And I want everyone to know at home that she has had a numbing cream on her face for quite some time.
Yes.
So how is it feeling right now, Michelle?
It's fine.
Yeah, the great thing about Voluma is we're placing it so deep along the bone that you really don't feel much other than a slight poke in the skin. And of course, she has had numbing on for about an hour before this. And the other nice thing about this filler, two most important things: it lasts about 2 years, up to 2 years.
Which is a lot longer than any of the other fillers, I believe, right?
And most fillers, like your Juvederm, last up to around a year. This is for 2 years. And she has had some before. This is kind of her touch-up, because of course you don't want it to go back to ground zero before you do it again. The other nice thing is it's dissolvable. So if Michelle does not like it, she can come into my office in 2 weeks. I usually say let it sit for 2 weeks, let's see what it's doing. She can come into my office in about 2 weeks, and we can dissolve it.
That's huge.
That is
How in the world would you go about doing that?
There's actually a product called hyaluronidase, which is an enzyme that dissolves hyaluronic acid, which is what this is. And so we can dissolve it and replace it wherever she wants.
Is there anyone who would not want to consider doing this?
Really only if you're allergic to some of the products, which I've really never seen. You know, I have found that, especially with Voluma, everybody is a candidate.
And how long is she going to have the red dots that we see?
Probably by the time she leaves the studio, you know, that's going to be gone.
So it's something that you would be able to even do maybe on your lunch break and go back to work?
We do it all the time during lunch break.
Okay, let's show everyone just quickly what you've done. It's going to be a little hard to tell because it's going to be red and swollen for a little while, I'm sure, right? But it gives you an idea that it's lifted the face a little bit.
It's lifted the face a little bit. And then, you know, years ago, what we would do is we would just come in and fill the nasolabials. Turn your head a little bit this way. We would fill this. Well, now what we do is we actually pick up the cheek, and that obscures this line naturally, which is really addressing the underlying problem and not the secondary issue.
There you go. Dr. Ingraham, thank you very much. Michelle, you did great.
Thank you.
Can't wait to see the finished product.
Thanks.